All right, I'm Eric Chong, and I'm the founder of healthstartsfrommouth.com. We do predental checks and patient education and advocacy. Essentially, we help people live their healthiest and best life without having to overpay or struggle with unnecessary pain, visits, doctor's visits, disease, or drugs so that they don't ever have to worry about being sick or going broke from medical or dental bills. The reason for this training is to help anyone that's in pain, sick, or knows or cares for anybody that is sick or in pain. And this is to share that information or give you the information that I wish I had 5 years ago, because if I did, I know that I would have saved my dad's life. So let's go ahead and get right into it. This is how to be healthy in the US. I spent quite a bit of time thinking about how to be healthy from my competitive swimming career from when I was a very young age, about 6 years old, and all the way up to now. I've always focused on health. I've thought of nutrition as something, it was instilled into me by my mom and my parents on how important it was to eat whole foods. And it was something even through and after being instilled of that wisdom, something that I took for granted. And I went on to live in the real world, if you will. And I know now more than ever how important and how critical that wisdom is for, living a healthy life. So the more I talk to people and meet people that are sick, I find that the information that I've been fortunate enough to learn and come by, not just from my family, but from meeting some of the top doctors and practitioners around the world, I just wanted to share that information in hopes that it could save you some money, some time, and some heartache that you don't have to go through. So let's go ahead and get right into it. All right, so the first thing is that health, it's natural and normal. Okay, this is something that should be a normal statement and everybody should understand, but hopefully this is a little bit of a surprise to you, because it does fly in the face. It's completely 180 degrees different than what you see on TV and what every single hospital, drug company, or most doctors' offices are trying to convince you of. That sickness is completely normal, that it happens all the time, that we don't know where it comes from, and that you need to visit a doctor's office or you need to take some drug to be better. And that can be nothing further from the truth. In fact, nobody is deficient in any drug, shot, or doctor, especially synthetic or man-made medicines, which anything that is labeled a medicine, by the way, is by definition man-made. So we'll get into that in my story a little bit later, but we are deprived of clean water, real food, real connection, meaning, and purpose, and that really is all we need to be healthy. This is the universal and real issue at hand, and it's a choice, right? You can run from these things that we talked about, or know that this is the only things that really matter and to focus on these things. And it is a choice. So go to a doctor's office or hospital to die, or live with disease and pain, right? Or avoid them completely. All doctors, drugs, and hospitals, especially any pill that they try to prescribe, and avoid them for a long, happy life that is free from pain, free from disease, full of happiness, joy, and healthy, right? And so here's what's going on right now in the US healthcare system. And it's a vicious cycle that tends to repeat, right? Because this whole sickness thing, because we're never told the truth of where it comes from, or the fact that actually we create sickness and we don't pass it on to other people. I know that sounds like a crazy thing, because we've all been told over the last 3 years and convinced that we get sickness from other people. But think about it, even yourself. Whenever have you been in a classroom and everybody all gets sick? It doesn't happen that way. You might get 2 or 3 people sick, or you might see 5 or 6 or 7 people sick. If there truly was a pandemic, yeah, maybe even a third of the people would be sick. But why doesn't everybody get sick? And that has to do with the beauty and the intelligence of our immune system. Now, that's not the purpose of this presentation, but I do want to share right now, we pretend all of that intelligence that we've learned over thousands of years, millions of deaths, autopsy, and studying this, we're going to just throw that all out the window. We're going to just pretend we just get sick. Whether it's an invisible virus, a visible virus, I'm not saying that viruses are invisible. They are so tiny we can barely see them. But we have billions of viruses in us, in a healthy person. For any one doctor to think that they can isolate one virus and say that it's this one virus, not the other billion that are running around in your body, is not just arrogant, it's quite laughable to me when you actually understand the science. So again, this isn't to go into a whole conversation or a debate about what is or what isn't. But I'm just going to tell you what I've learned, and maybe what I've learned will help you too. Because what I've seen in the current US healthcare system is somebody, they just wait till they get sick, right? They wait till they get the sniffles or they get a fever, and they don't really think of why they get it. They just wait to get it. And when they get it, they might test for it, or they might just go to the hospital. But point is they go to a hospital or they go to a doctor's office. Doesn't have to be in that order, whether they get the test, hospital, doctor's office, one or the other. But the point is, they don't realize, and it doesn't matter where the TV is, whether the patient is watching the person on the TV or whether they don't watch that person at all. Because right now the doctor is listening to another doctor on TV. And the problem is that doctor is paid to sell a product or to promote a service. And that's what most people don't realize. Everything you see on TV is designed, or it's there to sell you on a product, service, or some kind of idea, including this one, right? And that's the thing, is so whether the doctor is listening to a person on a TV or whether the doctor is listening to another doctor on TV, the point is that person's probably paid by a drug company or some company that is going to profit off of giving you some kind of drug, right? Some kind of treatment that you can either take or inject. And so when you start taking this drug, the problem with these drugs is statistically, once you take one, you are taking 4.3 more within the next 18 months. This is true with any pill or any injection that we take. And so before long, we're not even sure what is keeping us sick. Is it really that we're sick? Or could it be possible that the medicine and the synthetic drugs that we're taking into our body is taking the vital nutrients from our body, and it's creating this vicious cycle where we not only stay sick, we don't even know what is creating the sickness anymore. And that's exactly what is happening in our US healthcare system. You've been lied to. It's keeping you and your family sick and spending money you shouldn't. Almost everything you've been told about healthcare and about being healthy is wrong. And only you can choose your best health. I mean, if you look at the autism rate alone, it was about 1.5. So only 1 or 2 out of every 100,000 births. And that was just 20 or 30 years ago. But now it is 1 out of every 15 babies has some form of autism. I don't know about you, but that didn't just come up out of nowhere. And that was with this allopathic, and that's just a fancy word, but it's when we started introducing drugs, synthetic drugs, both taken orally or injected into our body. So what did we used to do? There was a very simple, and it's not like 3 steps, but this is what we used to do. And I think we would all agree. We didn't live in isolation, glued to our phones, living in a room where we don't ever have contacts with family. We lived together. We shared meals. And regardless of what anybody told us, we stayed together as a family, as a community, with friends. And we knew that rolling around in the dirt didn't make us sick. It actually made us healthier. It actually strengthened our immune system. What doesn't kill us does make us stronger, right? Only, though, I have to put an asterisk on that, only when it's natural and only when it's done, through accidents or through life. We shouldn't be putting anything synthetic into our body. So in the past, and what I recommend in the future we still do, is just, it takes a village to raise a child, and we learn those lessons, we share stories, and we learn what's worked. When we went to that doctor's office, we learned what works and what to avoid. But right now we're so separate. Even if one of our family members goes through a struggle, we never really fully understand and learn from that lesson. So we keep on repeating the same mistake. Another thing that has gone away is the people that live to old age are the people that are doing this now, right? Everybody that goes to a doctor's office or goes to a hospital and asks for the first drug every time they get a hiccup, they're not the ones that make it to the old age, unfortunately. And I'm not trying to say something with my words or project it out there, but that's just what I tend to see. The people that we really want to, model after or live after are the ones that make it to 100 without disease, without pain, and without sickness. And unfortunately, statistics say that that's not doctors. Doctors actually tend to die quite early. So we shouldn't be taking health advice or living long advice from doctors or scientists. We should be taking it from people that have lived very long. And if we do that, we'll be in a much better shape. And doctors in a healthy situation, we know what keeps us healthy and we know what makes us sick because we've learned from family, from sharing stories, and from learning lessons from other people, from other patients. So we don't need a doctor to keep us healthy. We can keep ourselves healthy, but you only ever need a doctor in a very rare circumstance where there's a rare illness, a rare disease, or maybe there is some rare bacteria or illness that is going around. And that's when we need a doctor. We're using a doctor far too often now, and that's why most doctors prescribe drugs when even they will admit that there are much healthier options. Doctors will admit that they get obese people all the time and they prescribe them drugs, not because it doesn't work to go outside, to exercise, to drink water, and to eat healthy food, but because doctors know that they wouldn't get paid for telling them what to do and the right advice, but they will pay for a drug, even knowing that that drug does hurt, does harm, and does leach other nutrients, vital nutrients, from their body. All right, so for me, what I want to do is share a little bit of my story. I'm going to share a little bit of my why, and I'll do a little bit about of that in this video, and share what we'll be touching on in the other videos, because I won't have time in this one to share everything. So this one is going to share a little bit more about my story and my why, but then we're going to get into the health starts from mouth philosophy, how it came about, what it is, and why it is so important. And this isn't just for doctors. This isn't just for dentists. This is something that every patient should know and understand. And I hope it's easy enough for anybody. I think anybody, even 6 years old, should be able to understand this concept. The next topic that we're going to get into is dental is medical. So this is the biggest thing to just remember as we try to navigate the healthcare system. It's the biggest secret that I wish I could share and wish I knew 5 years ago. And it's not really a secret, but I'm going to share with you some things that very few people know. And it's like having a secret or a cheat code to life and to health, especially navigating the healthcare system. We'll get into healthy habits, what they are, what are really the healthy habits that facilitate or that support a healthy life, and what are the things that you should avoid. It's much more simpler than you think. I'll give you a little hint, but you don't want to miss this stuff because it is very easy to get complicated or overwhelmed. There's way too much information out there, and it's important to know the simple fundamentals that really make the difference. And all of this so you can enjoy life. Again, there's way too much stuff out there and way too many choices. So it's getting down to, this isn't a whole philosophical, class about how to identify your life's purpose, but if you're sick and you're in pain and you have disease, you really don't have the freedom, or you don't have the time to enjoy life in the first place. So I want to help you at least get out of pain, out of sickness, and out of disease, and I'm confident that this will do that. By the way, if you did want to connect with other patients or with me, we have a patient group that we have, and you can go to hsfm.co. Yeah, it's healthstartsfrommouth.co/join-insider. So if you go to hsfm.co/join-insider, or you could take a screenshot, or scan this QR code, and it should take you to a page that you'll be able to apply and join. You'll want to join this because as a patient, even if you're not a patient now, this group isn't really, I know it says patient group, but that's just because the word we use. The goal is so you don't ever have to be a patient, and for patients to get out of being a patient, because we're all people first. And we'll have special giveaways in there. We'll have some challenges, exclusive content, and event invites. So I strongly recommend you join Dental Insider, especially if you want to be healthy, or learn the inside tips from the inner circle on really what works to get you healthy, and so you don't overpay and you don't have to pay something out of pocket that you didn't have to. If you want to get training like this and other training videos out there, go to healthstartsfrommouth.com, and you can get this video as well as the other videos and downloads for all patients and people out there. So again, you can type that into your browser, or you can take a picture or screenshot this page. And if you like this information, please share this with anybody that you think might benefit from this, anybody that could be a little bit healthier. I wish I really knew that 70% of all heart disease and breast cancer starts from the mouth, and that 90% of all disease in the body, really, we're finding out, starts from the mouth. And it seems like a very shocking number at first, because it's very different than the way that healthcare works now, and the way that we treat patients. But as this information gets out there, we are improving, and the healthcare system has better options. So we're here to help, not just with this information here, but if you need to speak to a health planner, or if you just want to learn more, again, you can go to healthstartsfrommouth.com, and you can find more videos like this, resources that you can download. And my intention is for you to have your very best health now. I'll see you on the next video.